Greetings, passionate advocates of change and distinguished delegates present at the Global Youth SDG Summit. I welcome you all to the dedicated social impact project, which is presented themed on Sustainable Development Goal number 3, good health and well-being. Introducing myself, it's me, Rajkumar, a 17-year-old high school student studying at AJ Science College, Mirpakas, and working relentlessly towards the United Nations Sustainable Development Goals at the AJ Welfare Society. For a brief overview of my portfolio activities, you can just have a look onto my Facebook and Instagram account. When it comes to the 17 Sustainable Development Goals, what do they signify and what is their purpose will be discussed in a separate video. But for now, we are going to focus mainly on Sustainable Development Goal number 3, which is good health and well-being. So, Sustainable Development Goal number 3, good health and well-being, aims to ensure healthy and prosperous well-being for all people of all ages. This goal includes targets such as reducing maternal and child mortality rates, combating infectious diseases, improving access to affordable and quality healthcare services. Last but not the least, it also enables individuals to work towards promoting an effective mental health and well-being. Achieving SDG number 3 is quite crucial to building a more sustainable and equitable future as it is correlated with other SDGs tremendously. And in that regard, we are going through a very crucial and supererogatory time period in which we need to remain beyond our efforts and work towards the Sustainable Development Goal number 3, good health and well-being. A few examples of what I talked in the recent slide are the conditions of a waiting area in a civil hospital in the city of Mirpakas, where I reside. As you can see, it seems as if a graveyard is there over which no one has visited for the past 10 years. This is a condition of a waiting area in a civil hospital where patients are sitting down on the floor and sleeping all around, which is quite detrimental for individuals who are supposed to get the rights to equitable healthcare within these hospitals. And this is a condition of a government hospital, particularly the emergency ward, where individuals, instead of getting the proper healthcare, are rather not given the facilities they deserve. When it comes to the problem statement, it's quite obvious that the pandemic and other ongoing crises are hindering progress in achieving the Sustainable Development Goal number 3, exacerbating existing health inequalities and threatening progress towards universal health coverage. As a result, 68 million children are known to be or under vaccinated as of 2022 from tuberculosis and malaria. This has been particularly challenging in low and middle income countries, such that individuals from various social, cultural, and social demographic backgrounds do not receive the characteristic treatment for every human. So when it comes to a particular solution, which quite infuriates me towards getting a positive impact in making Sustainable Development Goal number 3 accessible to all individuals within our global community, starting with my own region, Pakistan. So the impact project which I have decided and presented within the conference is the National Health Alliance, the creation of Pakistan's largest and first digital youth-led healthcare project, which aims towards empowering equitable healthcare resources accessible to all individuals residing in Pakistan, regardless of their socioeconomic background, gender, caste, color, age, or sexuality. Some salient features for the National Health Alliance are its mobile app and its prototype website. When it comes to its mobile app, there are certain features which includes the locations tab, which enables Pakistani citizens to access healthcare services from various healthcare sectors, either urban, suburban, or rural, to consult healthcare experts or even just call an ambulance pennilessly. Apart from which, we are having the impact reporting tab, where individuals will be accessible to young change makers and leaders to present their impact led at a local, regional, or national level. Given the facilities provided, moreover, participants will continue with empowering ideas in Pakistani healthcare sector, which will be ultimately recognized by the National Health Alliance and the government of Pakistan, alongside which would be highly appreciated by healthcare sectors such as Pakistan Medical Council and Pakistan Medical and Dental Colleges. After which, we are having the communities tab, which will enable young minds to collaborate with a diverse community and consult health care professionals nationally and internationally to discuss important topics and consult virtual appointments, which would be penniless. After which, the feedback tab will enable the users to receive the feedback about healthcare facilities as well as provide feedback about healthcare facilities available within their regions to actively empower healthcare facilities by advocating for necessary assets such as healthcare services or other healthcare resources, which involves proper sanitation, sewage treatment, clean water supply, proper food providal, as well as the obtainal of several funds and grants available for poor individuals and visitors. And these reports will be ultimately submitted to the concerned sectors of government of Pakistan, including the Ministry of National Health Services, Pakistan. Some other salient features includes the availability of program as a valuable internship and volunteering opportunity to several undergraduate medical students within Pakistan, presented by this dynamic platform. It will enable vaccination services available online for individuals to vaccinate accessibly, free of cost, so that they can work towards a healthier future. After which, we'll be having affiliation with Pakistan Medical Council, Pakistan Medical and Dental Colleges, and other national and international platforms, which will enable individuals to receive loans for their medical insurances once they get indulged into the National Health Alliance. Here's the prototype of the website where you can see a home tab, after which there's a get involved tab where several individuals as well as international organizations can work towards the National Health Alliance and make healthcare facilities accessible to all individuals within Mirpurkhas, as well as the region of Sindh and ultimately the region of Pakistan as a whole, which will enable us to create a positive and a relentless impact within the society. After which, we have partnerships tab for partnerships with several international organizations. After which, we are having the About Us tab, which would be for introducing the team leads and all of those who took the initiative towards making this project a successful and a resounding impact. After which, we are having some goals affiliated with the National Health Alliance, which includes SDG number 6, clean water and sanitation, SDG number 1, no poverty, number 4, quality education, SDG number 17, partnerships for the goals, SDG number 8, decent work in economic growth, SDG number 9, industry, innovation, and infrastructure, SDG number 11, sustainable cities and communities, and SDG number 2, zero hunger. Here's a summary of our impact project, which is based on creating Pakistan's largest and first youth-led digital healthcare forum, National Health Alliance, aimed at empowering good health and well-being at national, regional, and local levels. Now, here's a brief summary written of how the organization is going to work, including its mechanism and organizations, such that individuals who intend to volunteer at an internship will gain the following opportunities, including e-certificates, portfolio buildings, and letter of recommendation leadership positions, which they can utilize for their college applications as well. After which, individuals who will be benefited by this program would be ultimately individuals who are suffering from physical, mental, and dietary problems, as well as healthcare professionals who intend to gain expertise within their respective field, as well as undergraduate students willing to attain internship and volunteering opportunities by a national platform. Collaboration would be done with the Ministry of Healthcare, Ministry of Planning, local startups such as Careem, Uber, and TMC and PMNDC. Moreover, Forum is an international platform which would be collaborating with the National Health Alliance. Partners here includes uh, Raj Kumar, Mushtaba Mari, Abbas Ali, and me, Muhammad Afnan. After which we are having some proponents from international platforms such as Kyriaki from Greece, Alice Libero from Brazil, Yash from India, Khalik from Afghanistan, Ra from Egypt. And ending our presentation with a good quote, which is presented by Guy Kosky. A good idea is about 10%, and implementation and hard work and luck is 90%. So this is what signifies the real effort which is required to make this project a resounding success. Thank you everyone for joining this meeting.